Namaste and welcome back to our channel. Today, on the occasion of World Tuberculosis Day 2023, we're going to talk about tuberculosis in India and what we can do to end this disease. India is one of the countries with the highest burden of tuberculosis in the world. In 2021, an estimated 2.7 million people in India had TB, and 449,000 people died from the disease. This is a staggering number, and it highlights the urgent need to address this issue.
TB is a major public health challenge in India, and it affects all sections of the society. However, marginalized and vulnerable populations, such as people living with HIV, slum dwellers, and migrant workers, are at a higher risk of developing TB. To address the TB epidemic in India, the government has implemented various initiatives such as the revised National TB Control Program, RNTCP, and the National Strategic Plan for TB Elimination. These programs aim to provide free diagnosis and treatment for TB and to improve the quality of care. However, there are still many challenges to overcome. One of the biggest challenges is the high rate of TB drug resistance in India, which means that the standard treatments may not work for some patients. This highlights the need for better diagnostics and treatments for TB. Another challenge is the stigma and discrimination faced by people with TB in India. This can prevent them from seeking care and can lead to delays in diagnosis and treatment. To overcome these challenges, we all need to work together. This includes the government, healthcare providers, civil society organizations, and individuals like you and me. We can do our part by spreading awareness about TB and ending TB stigma. Here are some ways you can help. First, educate yourself and others about TB. This includes learning about the symptoms, how it's transmitted, and how it can be prevented and treated. Second, support organizations that work on TB in India. This can be through donations or volunteering your time and skills. Finally, ending the stigma associated with tuberculosis is crucial in the fight against this disease. Stigma can prevent people from seeking care and can lead to delays in diagnosis and treatment. It can also lead to discrimination and social isolation for those who have been diagnosed with TB. To end the stigma associated with TB, we need to educate ourselves and others about the disease, challenge myths and misconceptions, and promote empathy and compassion towards those affected. We all have a role to play in ending TB stigma and creating a more supportive and inclusive society. In conclusion, TB is a major public health challenge in India, but it's not insurmountable. By working together and taking action, we can end TB in India and save countless lives. Remember, every step counts.